Good evening, everyone, and welcome to Taking a Bite Out of Inequality, Universal Dental Care for Canada. I'm Roger Moran, founding member of the Democratic Socialists of Canada and co-host of the DSC's official podcast, New Left Radio. I'll be your moderator tonight at this special joint event presented by the Coalition for Dental Care and the Democratic Socialists of Canada. Dental care is an integral part of a person's overall health. When Tommy Douglas first laid out his vision for universal health coverage, Medicare was only a single prong. Indeed, Tommy's vision included mental health care, vision care, and of course, dental care. He understood that a person's health is holistic, and so do we. Before we get the evening underway, I wanted to give you all a bit of an idea of what to expect tonight. We're going to start by talking about the current state of dental care in Canada. What's working, what's not, and perhaps most importantly, why it's not. Then we'll move on to talk about what a better alternative looks like. And lastly, we'll talk about how to organize around this idea of universal dental care. As we all know, it's one thing to sit around and chat about what a better system or world should look like, but things only change when we do the work. We'll be consulting an expert for that part. By the way, we want tonight to be as interactive as possible, so please feel free to submit any questions you might have to me via the chat function. If you can remember to do so, please send them as a private message, just so we're not bombarding the entire group with questions. I will be moderating the questions and asking them on your behalf to our speakers. I'll try to get through as many of them as I possibly can. Please also ensure that your microphones remain muted for the duration of this event. Now, to start things off, let's talk about the current state of dental care in Canada and what a better alternative looks like. Joining us to do that is Dr. Brandon Doucet. Brandon is a dentist practicing in Newfoundland with interests in surgery and public health, and he's a founding member of the Coalition for Dental Care. He has written extensively on the importance of universal dental care in Canada, with pieces published in the Tyee and Spring Magazine, just to name a few. It was our pleasure to have him as a guest on New Left Radio a few months back, and we at the DSC are delighted to be working with the Coalition once again on tonight's event. Brandon, it's so great to see you.
Thanks for having me, Roger.
Absolutely. We're really excited to chat with you tonight, and really excited, we at the DSC are really excited to be working with the Coalition here on this event. So maybe we could start out by talking about the current state of dental care in Canada, what's working, what's not, and like I said, perhaps most importantly, why it's not.
Sure. So in order to understand how our current dental care system functions, we have to first start off with what you've already mentioned, which is that dental care was not included in our universal health care system. This means people rely primarily on work-related insurance and out-of-pocket payments to access dental care. So to give numbers to this, 95% of dental spending is private and only 5% goes towards government programs. This is actually a lower number going towards government programs on dental care than even the Americans. And the 5% of public dental spending that I mentioned goes towards targeted programs, so helping, some marginalized groups. But the success of these kind of welfare programs are limited because the funding is more likely to be cut for these programs as they help marginalized communities. We don't see the broad public outrage when funding is cut like we do when we see universal programs get cut. Because of this limited funding, targeted programs tend to cover limited procedures and pay dentists a fraction of what is indicated on a normal fee guide. This leaves many people who are covered by these programs to actually struggle finding a dentist who will accept them. I can speak firsthand to this. I see this quite often. It's sad to see, but it is also kind of a reality when you have, say, a lineup where someone can get paid, let's just put a random number, $50 for doing this for one person and $100 to do it for another person. The person who's going to pay more is going to be in a quicker line to say, whereas the other one's going to be in a much slower line. Even with these targeted programs in place, we see over 1 in 3 Canadians lacking any sort of dental insurance, and over 1 in 5 Canadians avoid the dentist each year because of financial constraints. And these numbers that I just mentioned they're rising. We're seeing large numbers of older people losing their work-related insurance as they retire, and a lot of younger people are working increasingly in the gig economy, which provides temporary employment without benefits like dental insurance. So these are all trends that we're seeing before the COVID-19 pandemic. Now that we're in the middle of an economic downturn, these trends are pushed into hyperdrive. So people are, many people are becoming unemployed, or they're working reduced to no paid hours. So this means people are losing their work-related dental insurance. And on top of that, they're losing disposable income to pay for these services out of pocket. So without drastic changes, we're going to see more Canadians start to avoid dental care because of financial constraints. And, certain communities are going to feel this pain more. So, low and middle income communities, people of color are going to be disproportionately affected by this. And this is something that happens periodically as economic downturns happen, every 7 to 10 years or so. And there are predictable consequences when dental care is neglected. Poor oral health has been shown to cause or worsen many general health conditions like heart disease, diabetes, stroke, there's many, many more. And there's also effects on nutrition as well. For instance, 1.8 million Canadians are unable to chew. And you could imagine if you can't chew, it's really hard to have a balanced diet and lead a certain quality of life. Poor oral health also has many social and economic consequences as well. For instance, it's difficult to find a good paying job if you have visible decay or you're missing front teeth. These problems really just perpetuate the cycle of poverty and make people sicker. When this happens, we also put an added burden on our Medicare system because people are less healthy. We also need to think of what happens when people can't afford to visit a dentist. Well, many end up going to their doctors for dental pain. For instance, the study showed that in 2014, Ontario's doctor's offices were visited 220,000 times and emergency departments 67,000 times for patients seeking treatment for dental pain. And using minimum estimates, this cost taxpayers $38 million in Ontario in 1 year alone. So given the inadequacies of our private dental care system for so many, I really suggest that we reconsider how dental care is delivered in Canada. And this is really why I founded the group Coalition for Dental Care with some students at McGill and Dalhousie to advocate for a more humane alternative, because our dental care system can work well for some people, but it doesn't for large swaths of the population. And the people who it does work well for, this is on precarious terms, because what if they become unemployed? What if they're relying on their partner's insurance and they leave their partner? There's a lot of precarity, or if they retire, there's a lot of uncertainty in that regard. And over those years where they don't have dental insurance, people neglect care, which leaves problems like small cavities to get larger and leaves people with poorer oral health.
Yeah, absolutely. I think it's, you raise a lot of interesting points there. A few things I'd like to sort of to touch on. So, you mentioned the, people who would be, who are unable to pay as much, perhaps, the full sort of like fare if it's subsidized by the government, the full fees rather, that they might be in sort of like the longer line, the people that have money, are able to sort of get the work done ahead of time. I think a lot of people might sort of like point the finger at dentists about that, right? That like, oh, well, you're just sort of like in it for the money. But, I'm certainly not a medical professional, but I work at a medical school here in Western Ontario. And I know how expensive it is to go to dental school and to medical school. And particularly for those who are setting up to have, their own practices, dentists in particular. We're talking hundreds of thousands of dollars on top of the debt that you incur from the exorbitant tuition costs of going to dental school in the first place. So, I think that it's important for people to remember that, dentists have bills to pay too, and it's really, this is, the fact that people with money can get to the front of the line is really, that's really an indictment of the system as opposed to the individual, right? And I think that's an important distinction to make.
Yes, I think it's an important distinction to make because it is a predictable consequence of structuring a system this way. I mean, I think I'm not trying to make the point that, say, a filling should cost this much versus this much. I think there's definitely a conversation to be had there. I just think if you're going to set it up where one person is going to pay this much for a procedure, whereas another person is going to get paid this much for a procedure, it could be doctors, it could be dentists, it could be anybody, but the problems that are associated with that are going to happen because of setting things up that way.
Yeah, it's like a two-tiered system, like we see in the UK or things or in countries like that, right, where they have a universal program, but it's not really universal at all, is it? It's two different tiers. So, I think we'll try to incorporate maybe the questions as we go along here. I'll just throw this one out here. So Sabin Ahmed asks, are the prices of procedures standardized?
No, they're not. So the way fees work in dentistry is each province, the dental association puts out a recommended fee guide, and dentists are not, they don't have to follow it. They can charge whatever they want. Many do, but there's no kind of legally binding measures for that.
But there are limitations on what insurance companies will pay out, though, for those procedures, isn't there?
There's a limited number, yes, that insurance companies will pay out, but oftentimes what happens, say if a dentist charges more, it just ends up that the patient's co-payment's going to be increased.
Right, okay, yeah. So, we also talked about, the consequences on the economic consequences for the province as far as, trips to the emergency room are concerned. What was the number you put out there again? How much did it cost Ontario?
It costs a minimum of $38 million per year. And when I say a minimum, they use minimum estimates. But if someone goes to the emergency department, I think the number is about $500 it would cost them minimum. But if that person has to be hospitalized, that cost jumps up to closer to $7,000. So if people are left to get, where they have a big facial swelling, they have to be hospitalized, hooked up to an IV, that cost jumps up quickly.
Yeah, of course, yeah. So if a person ends up having to go to the emergency room, say for dental pain, is the issue being treated when they're there, or is it more pain management that's happening there?
It's basically what doctors will do is prescribe an antibiotic and pain medications, which is really just a Band-Aid solution until they're able to get in to see a dentist. The main reason people go to the doctor for dental pain is because they have like a dental abscess, so like an infection around a tooth because of a big cavity. And the treatment for that is either to have a root canal done or to have the tooth taken out. And that antibiotic is really just a Band-Aid. So when you look at the money spent on that, it doesn't even end up fixing the problem. So it's really just a waste.
Yeah, I mean, absolutely. They're just going to end up there again, because if they could have gone to the dentist, they probably would have done that in the first place.
Yes.
Yeah. So, I've got to say it's kind of rare, I think, to have someone in the healthcare field, being such a proponent for universal coverage. So, I mean, you're obviously really passionate about this. You're part of this group that's growing across the country. You started it, like you said, with, in a joint venture between like Dal and McGill. So, why? Like, why is this such a big passion for yours, and why are you such a strong believer in universal dental care?
I think for me, I was very fortunate to be able to afford the dental care I've needed as a child, my parents as a child and in my adult life. But I think it takes a lot of humility to realize that there's very subtle changes in our lives that could have led to me being one of those people who couldn't afford dental care. And I would want somebody in my position to be advocating for these issues. And I think, there's a lot of eye-opening experiences I've had, whether it be during my time in dental school or since I've graduated, where you see people come in needing all their teeth taken out. And this isn't just isolated to, older people, or, you'll see it in younger people as well. And I get it. Some people say that's an individual's responsibility. Sure, to some extent, you have to take care of your teeth. You need to, not drink sugary drinks and stuff like that. But it's really, to me, an indictment on the system that is, where people actually get to a point where they need to get, say, all 28 teeth taken out in one appointment. And like, they've been living with rotted teeth for months and months. And I speak with these people. I like surgery, so I tend to take on some of these cases. But what we see is that, like, a lot of these people say, well, I couldn't afford to get treated partway through. So that's why they let it get to the point where they need all their teeth taken out, rather than, maybe they need a few fillings and a few teeth taken out. That's, part of life. But in then getting a partial denture where they still have most of their teeth, quality of life is going to be a lot higher. And they're not living for years and years with broken down teeth, infection, pain, everything like that.
Well, like you said, it really affects people's quality of life in so many different ways. I mean, their physical health, their mental health. It could even, impact, like you said, like the ability to find a good paying job that maybe would provide them with benefits in order, that could sort of solve that problem. It's this sort of this vicious cycle almost of that people who are, not, particularly well off, those that aren't experiencing a ton of privilege, we're not, we don't have the same kind of access. And there's something inherently really wrong about that, I think. And I think as Canadians who believe that, everyone should have access to the same, kind of care, this is a big problem. I know that the idea of universal dental care is, really quite popular across the country. So I think, and we'll get to this later on in the evening where we talk about like what we can do. So, for the first part here, we've talked a bit about like sort of what's the current state of dental care in Canada. I think we have a pretty good idea. It's not great, I think, is the summary that we can take away from this. There's a lot of room for improvement. So the next question, I guess, is, so what does a better system look like? I mean, we can sit here and we can talk all night, and I think that we really could, about all the different ways that it can be improved and the things that we think are wrong. And we all, I'm sure, have, experiences that have left us less than satisfied when it comes to dental care. So you've outlined and you have an idea about what a better system can look like. Would you mind walking everyone through that?
Sure, yeah. So me, along with the Coalition for Dental Care group, is advocating for changes to our current dental care system that follow three main principles. So I'll kind of introduce each one and go over some information benefits of each one. So the first, and I think this has to be the starting point for any conversation on this, is universal insurance. The reason for this, everyone has to be guaranteed dental insurance, because when you don't, there's an instability in accessing dental care when people rely on work-related insurance. When you lose dental insurance, you have to pay for these services out of pocket, and it's very hard to scrounge up the money to do this. So what ends up happening is people neglect care. They don't get cleanings. They only put money towards, a pain and like a toothache or something like that, when they should be going to get small fillings done rather than letting them grow until the point that they give them pain. And this is a big problem. As I mentioned, over 1 in 3 Canadians lack dental insurance, a number that's actually rising. And even the people who are insured, as I mentioned, many are underinsured with large co-payments and too few services covered. And people with insurance have to worry about becoming unemployed, retiring, all these different problems. So if we expanded Medicare to include basic dental care, this problem would be eliminated. People would be guaranteed dental insurance for life. This removes the instability from work-related insurance, and it also frees up unions to collectively bargain for other demands. It also reduces dental neglect because, people don't have to go for years without dental care because they don't have insurance. I know some people might respond, maybe not necessarily in this audience, but a frequent thing I hear is, well, there's going to be added government spending in comparison to targeted programs for a universal system. And my response to that is that we really have to consider overall spending, not just government spending, because I think that's a better metric for something like this. So for instance, yes, government spending will go up if you guarantee everyone insurance, but also we eliminate out-of-pocket payments, premiums for insurance, all these different things that people already spend tremendous amounts of money on. Also, when you shift this to, rather than an individual paying to taxes, you can also shift the burden of cost for dental care onto the wealthy, because you can structure the tax system as you like, rather than individuals paying for care, you know, as individuals or as collective unions. You don't have the ability to say, okay, if you make over $10 million a year, you're really going to, you know, help people who make below $30,000 a year. You know what I mean? Like you can set up the tax system to help you in that way. And I think when we actually look at the spending overall, we can compare Canada to countries that include dental care and our universal healthcare systems. And what we find is that the countries that do include dental care in their universal healthcare system spend much less than we do. For instance, there was a study done that showed dental spending in 2010 and showed Canadians spent on average $310 per person for dental care, whereas in France, that number was only $170. So far below what Canadians spend. So, you know, there's benefits of not having people neglect care, but also under a universal system, we can lower the cost per unit delivery of service. So we can really sit there and say, should a filling cost $250? I mean, you know, there's a conversation to be had there. And that's something I want to talk about in the further points about our proposed dental plan. The next part after universal insurance is really like, when you guarantee dental insurance to everyone, that's a huge step in the right direction, but it doesn't guarantee that you necessarily have a dental provider in your community. This is because dentists decide where to set up clinics. They make this decision, and this has resulted in many dentists setting up clinics in wealthy areas of big cities so that they can focus on luxury and cosmetic procedures. This has left a dental shortage in many communities, such as, you know, poor, rural, and Indigenous communities. That is why we are advocating for publicly owned dental clinics, because this is a more effective approach to serving these communities that are now neglected under our current dental care system. I see this firsthand as a dentist myself. I work in rural Newfoundland, and I have patients who have to drive an hour and a half to come see me, or 2 hours, and it just results in people making fewer trips. They have to take a whole day off work to go for their appointment. It doesn't really, you know, much harder in the winter time and stuff. So the Coalition for Dental Care and we're advocating for these public dental clinics to be in poor, rural, and Indigenous communities, but also in schools, long-term care facilities, and prisons. And in general, this public ownership, it's more cost effective than the traditional private practice model. Governments can, they can hire staff on a salary rather than the traditional way dentistry is delivered, which is on a fee-for-service model, which is more expensive. And also, we can maximize the use of what are known as mid-level dental providers. And that's actually the next thing I want to talk about, because I really think this is an exciting area of dental care. To me, this is like, I want everyone to know about this, because when I started learning about it, I couldn't stop reading about this. And it's unfortunate because dentists have been very hostile to mid-level dental providers, also known as dental therapists. And some might wonder why. Well, because these mid-level providers cut into their monopoly on care. Dental therapists, they can perform routine dental procedures like diagnosing cavities, performing fillings, extracting baby teeth at a fraction of the cost of what a dentist would charge, which is why organized dentistry has done everything to keep them out of the mainstream. there was actually a children's dental program in Saskatchewan in the 1970s and 80s that used dental therapists a lot. So under the NDP leadership, clinics were set up in schools where dental therapists performed the bulk of the work. The program was wildly successful. And I'm just going to quote here, actually, an economist named Stephanie Rezensoff. So to quote, "A relatively small proportion of the population is receiving dental care, and much of this care is received by those in higher socioeconomic groups. The results of this study of the Saskatchewan dental plan tend to support the contention that changes in the nature of dental care delivery system are such that inequalities in the receipt of care are eliminated," end quote. So the Saskatchewan Children's Dental Plan was wildly successful, mainly because of the use of mid-level dental providers, also known as dental therapists, and the accessibility of publicly owned clinics. At its peak, the program was treating 90% of school-age children and lowered the need for fillings by 50%. And unfortunately, in the 1980s, the progressive conservatives came to power and privatized the program based on lobbying from organized dentistry. And in 2009, the Harper government closed the last dental therapy training program in Canada. So this is the field itself is nothing compared to what it used to. And it's something that we have an opportunity to provide world-class dental care to everyone without breaking the bank by bringing dental therapy into the mainstream. There was a study in 2011 from the Canadian Centre for Policy Alternatives that estimated what a nationwide school-based dental program using dental therapists would cost. And they estimated it would cost $560 million. So for 5% of what we currently spend on dental care, we could provide world-class dental care to all school-age children. That's amazing to me. Like, it's not a lot. And like, let's also not forget that dental therapists they can work outside of the school setting as well. So our proposal is for them to work in public clinics. So this includes the community clinics that I've mentioned, but also long-term care facilities, places like prisons, and I'm sure there's other places as well that I'm not thinking off the top of my head. So, I really think that that's a very exciting area for dental care, that is the direction we should be going in. Because when we talk about a public dental plan, we need to look how to most effectively use our money, whereas people don't have that kind of democratic input in a private system. And when we have a public system, we could say, well, if we're going to use the private practice fee-for-service model, the cost for a filling would be much higher than if we had publicly owned clinics with dental therapists. So if we're spending, say, $70 for a filling rather than $200, we can make our money go a lot further. And, our proposal, I don't think it's unreasonable. We're not proposing to completely eliminate private practice. We're just saying we want to build public dental clinics, in the same places where private practice clinics exist. So we want public dental clinics in communities, in long-term care facilities, in schools, and dentists will also have their private practices, but it's something that over time, maybe we need a little bit less.
Yeah, well, and I think that, you mentioned earlier that dentists they get to select where they want to open up shop, which, of course, they should be able to select where they want to open up shop, right? But a lot of the times then, those are focused in highly populated areas and rural communities and communities outside these major urban centers. The people there don't have as much access. And if they're going to go into the city, sometimes that's a whole day trip. They've got to take off work, or they've got to use a vacation day if they have one, or right? As opposed to these, community clinics that can then be set up in these environments to fill that gap. There's obviously a service gap there, and this is a way, I think, that that could be closed a little bit, sort of make that access a little bit more equal.
Yes, I also think as well, like the salaried approach rather than fee for service has a lot of benefits for certain communities. So you could imagine trying to do a filling on a child with autism. That's going to take a lot more time and energy than, say, doing it on, some other child. who cooperates very well. So if you're incentivizing people to do, and provide the most fee for service, which means the more services you provide, the more money you make, it in a way disincentivizes you from providing care to those communities.
Yeah, absolutely. Yeah. So a question from one of our audience members, Adele, they ask, how can universal insurance lower the cost of treatments?
So universal insurance can lower the cost overall for many different reasons. For one, the way private insurance works is they try to make as much money off possible by skimming off the top what you give them to pay for dental care. So the profit incentive for basic insurance was eliminated. We can also talk about, you turn on the TV and you see advertisements constantly for drug plans, dental plans, and, all the time. Those are eliminated because you don't need them because you have a government dental plan. You don't see those ads for Medicare. We can also look at the kind of risk sharing aspect of insurance. And what we see with private dental care is that they try to insure people who are fairly low risk, because when they're low risk, they don't have to pay out as much in services. So they don't have to pay out as much of the money that people pay to them, which means they make more money. Whereas the people who are highest risk are most neglected from, they're excluded from that, whether that be, they're basically priced out of the market. And when they aren't able, those high risk people are unable to get insurance, their problems compound and become more expensive. So they become more expensive because they can't afford dental care, and problems get worse, which means they have more cavities, which are more things to be treated, which you can imagine emergency care is more expensive than basic care.
Of course.
And then there's also elements of these leaving large segments of the population to have to neglect their dental care results in those people becoming sicker as well, which spends a lot of money on our Medicare system, as well as, people going to their doctor for dental pain. So that's something that all of these things can lower hundreds of millions of dollars in wasted money on our Medicare system, all the advertisements that go for private insurance. And then there's also elements as well. If we're talking about a universal insurance plan, we can start having the conversation of how much should procedure A or B, how much should these things cost? And what we have with a private dental care system, usually this is kind of a tug of war between two battles, between, in a Medicare system, the doctors are wanting things to be more expensive and the public wants things to be, a little more reasonably priced, and there's a tug of war. But with our private dental care system, there's only one way tugging. There's no opposition. There's no public trying to act as a counterweight. So, perfect example in my mind, like someone going in for a filling and getting charged $300. I do these things day in, day out. I have a hard time imagining. I know there's overhead, everything. That's a lot of money for a simple filling. And I really think that under a universal insurance program, we can lower the cost per unit delivery of these services. And especially with things like dental therapists and stuff like that, there's so much room to make our dental care system better. And even for dentists themselves, I can speak if we had dental therapists doing fillings, people like me could focus on more complex procedures like root canals or, difficult extractions or things like that. Which I think is very beneficial as well.
Yeah, I think it's important that you talk about the costs that end up coming on the public when people then go into the hospital or things like that to get care. And it's interesting. We end up footing the bill anyway as taxpayers because insurance companies, like you said, aren't insuring the higher risk people, and so that their shareholders can continue to make as much money as they can, while we get stuck, sort of footing the bill, which is, I think, kind of always the case when it comes to privatized systems that really should be public. Adele had a follow-up question to about the universal insurance. So she wanted to know if the cost per treatment is lowered, does the profit received by the dentist drastically decrease?
It doesn't necessarily drastically decrease, because what we would see is that dentists actually have access to a wider population to treat. So, there's people who can't afford to get fillings done now that they're going to get paid for. A lot of dentists will do some free work for people because they can't afford it. They don't have to do that now. They're going to get paid. So there's a lot of benefits in this regard. And say dentists who treat people on targeted programs that pay a fraction of the regular fee guide, they would probably get paid more in those cases now, because they're under a universal system. Everyone's on an even playing field. So I imagine if we were to negotiate some sort of fees, what we would end up having is somewhere between the targeted programs we have now and the private fees we have now. There's probably somewhere in the middle, and that can vary from procedure to procedure. That's a negotiation to be had. But I don't think this has to be that big of an impact on dentists. I think there's also many aspects. I mean, dental school itself is about $40,000 to $50,000 a year for people. I think that should be a lot less. If you look at medical students, their tuition, I mean, it's still expensive, but I mean, it's maybe around $15,000 a year. I'm not 100% sure, but I think it's roughly around there. And I think a big decrease in that amount in tuition is because medical students work in public facilities. So they work in hospitals, they work in clinics that the government fund, whereas dentists have to fund their own clinics. So there's a lot more equipment fees and stuff like that for dental students rather than medical students. So there are a lot of ways in which this, like a universal type approach where we take a more holistic view to it, doesn't have to necessarily hurt. It doesn't have to be so impactful on dentists.
Well, and I think that the system you're talking about, as far as a salaried system rather than a fee-for-service system, would also, sort of maybe like alleviate some of any of those concerns that dentists might have as far as shifting over to universal coverage is concerned.
I do think it is important to note that while the way we structure this doesn't have to impact dentists, they can still be very well off and they can benefit from this in many ways. We have to understand that historically, dentists have been on the wrong side of many of these issues. So dentists have fought to not include dental care in Medicare. They did fight against dental therapists. So there is elements of, even when we're trying to do the right thing, no matter what you do, these groups will often be on the wrong side of these issues. And it's the same thing of doctors were against Medicare. I mean, in Saskatchewan, they went on strike to actually try to stop this, despite the fact that, I couldn't, if I was a physician, I wouldn't want to have to make someone's life or death treatment based on whether or not they can pay. And setting up a system that way makes it so that that happens.
Yeah. So I'm cognizant of the time here, so I think we should sort of move on to the next segment of our evening. So moving on to the last segment of the evening, organizing and advocacy around universal dental care, we are joined by Mr. Joe Roberts. Joe is a founding member of the Democratic Socialists of Canada. He is also my co-host on New Left Radio, and he has a long history and a ton of experience of working in political organization. Joe is also the Executive Director, Engagement and Strategy at the DSC. So he knows a lot about this. He's a qualified guy to talk about this. Joe, thanks so much for being here with us this evening. We're really looking forward to learning about what we can do to start organizing for universal dental care.
Absolutely. Happy to be here.
So maybe the first place we could start is by explaining, why organization is so critical to moving policy like universal dental care forward.
Yeah, so whenever we talk about anything that is this large and systemic, we're dealing with a lot of factors, as we've heard, right? We're dealing with a lot of money at play. We're dealing with a lot of private interests at play who would appreciate to keep the status quo. The status quo is good for them, may not be good for us. And so in order to do that, we have to counter that with a movement. And so, I really believe in creating social movement around Marshall Gans' theory of change, who is a professor at Harvard Kennedy School. He got his start organizing with Cesar Chavez, the United Farm Workers, in their struggle for fair wages and protections in Southern California back in the 60s. And he now teaches and trains people on a method that he has developed. And so what he really talks about is, in order to build power and to change the structure as we have it, we have to train people to join a campaign. These things have to be time limited. We have to say, we want to achieve this within 2 years. And here we have to create a strategy, which, it speaks to people's head, how they are going to work through this. We have to develop a narrative around, speaks to people's heart, why this is important. And then we actually have to create action through those two pieces. And the strategy and the narrative coming together is what actually creates the action. And so, a lot of his strategy talks about emotion, motivation, and action. So when we create that, we do it through a system that he calls the story of self, story of us, and story of now. And so talking to people about why this is important, you share your personal story, you get vulnerable about why dental care is important and why you might have had challenges accessing it. And then you talk about the story of us, why this affects all of us, even if you're not personally affected by this, how it affects us as a society and as a nation. And then you talk about why there's urgency, because urgency creates action. It overcomes inertia. And so we have to create that action and urgency. And so, really to be able to make a change on something this systemic, we need to build a movement around this idea and recruit people to that movement. And I'm really glad to see that, Brandon and Coalition for Dental Care is starting that process. We are definitely here to help do some of that training and to build that movement around this idea.
So, yeah, sorry, go ahead, Brandon. I was just going to ask, so what has how have you been building that movement? It started out with McGill and Dalhousie, and it has grown a lot, so even since we, first talked to you back in the late spring. So can you talk to us a bit about how did you build that movement? How did you get people involved?
Sure, yeah. So this is an issue that I've been passionate about for quite some time. For a little while, it was just me writing the odd article here and there, or having a conversation with a friend. But it kind of came to me that more than that needs to be done. It needs to be much more organized to actually enact change. So this actually started in January. I went to speak at a Canadian dental student conference in Vancouver on the issue. And from there was some interest, and we kind of organized some meetings. A bit difficult because COVID and the pandemic kind of took precedent for a lot of people for some time, especially students who are worried about trying to graduate, getting their credits, and how everything's going to work. But, as time went on, we were able to start organized meetings and, figure out how we want to start getting the message out. And, one of the things we've noticed is that as dentists and dental professionals, our voice does go further on this issue than the average person, unfortunate as that may be. So we think it's our responsibility to try to get this message out as far and wide as possible, to really educate people, highlight the need for dental care. And this is to kind of highlight something you spoke about, Joe, is that helping people realize and educate them how much this is a problem and the urgency. One of the things I've realized during my time speaking with people on this issue is that there's a lot of people who struggle to access dental care who think that, oh, this is a shortcoming of me. This is like, I'm the odd one out in this, and not realizing that this happens to large segments of the population. And I think tapping into that sentiment where people can kind of have that aha moment of, oh, it's not just me, or it's not me now, but it could be me later, I think is a very powerful thing that can help bring people who may be privileged enough to access dental care, bringing them to a point where they see this as an urgent issue, because, they're going to retire at some point and then they won't have insurance.
No, that's right. I think that, a common thing that we see is that, a lot of advocacy takes place on social media. using Facebook, Twitter to share stories and opinions and things like that, and raise these issues and let people know that these inequities are existing in the system here in Canada. And there certainly is like a really big place for that, and I think that's a really important part. But it's really only like a single prong of this organizational approach, isn't that right, Joe?
Yeah, absolutely. One of the things we talk about is tweets are not advocacy, right? They're public messaging, and that's important to draw awareness. But really, to change people's minds and get them to take action, it takes one-on-one conversations and it takes action. And so when we talk about that, there's a few ways to do that. I would say, in this case, sign up with the coalition or with the DSC. If this is something that you're very interested in and you want to work on this issue, sign up. We can build a coalition around this issue to start pushing a campaign for a national dental care program. So the way that we would do that is to actually recruit, train, have these conversations about how to tell that narrative story. Because while Brandon's absolutely right, definitely that dentists have a little bit more clout in this conversation and are taken more seriously. If you have a group of 5 or 6 people, one of which is a dentist, 2 of which is a dentist, and the rest are regular patients who say, I have challenges getting dental care, and you go and you meet with members of parliament, or you testify in parliament around legislation, those kind of things are very effective. And if you're trained on how to tell that story in a way that anyone watching the clip or anyone listening to you in the room for 45, 60 seconds can relate to that experience, even if it's not their lived experience, that's what moves the needle, because that creates the empathy for others. So yeah, I would say get involved. I would also say that a campaign like this costs money, unfortunately, because there's a lot of training involved. You have to be able to push on the national level. So donate to the coalition, donate to the DSC, and try so we can be able to afford these campaigns and the trainings that are necessary to train people to actually be organizers. Like I always say, organizing is not it's not something you're born with. It's not something that's inherent to you. You have to learn it. It's a skill. Not only do you have to learn it, you have to practice it and hone it. And it takes 6 months to a year to get really good at organizing. But once you do it, it's a skill set you'll never forget, and you can use it to get national dental care, and then you can use it for the next campaign and the next campaign to help us change our society.
Yes, and I think that's something that I've even found myself struggling to. Like not having necessarily, I have skills in some areas, but not in others. So we've had a lot of interest from people in the group. And one of the things we've been struggling is like, how do we actually get people engaged and get them harness this energy and push something? And that's something I think we're still learning on. I mean, I myself have certain skills, certain kind of creative abilities, and I've been trying to take on projects. Like I'm partway through writing a book on kind of the history of dental care in Canada, all these different things. And I'm also hoping at some point we can make a documentary film, but I also acknowledge, those are kind of areas that I have interest in. I can kind of, pull things together. Whereas I think there's a lot of help that we can get from people in the public, other people who are interested in, people who have skills other than what kind of we do.
Yeah, and I would recommend, so one place that you can get this training right now, they actually are having a cohort start on Monday, is the Institute for Change Leaders at Ryerson University. It's Olivia Chow started it about 4 years ago, and they train on the Marshall Gans method. We're sending 3 new organizers to this training starting on Monday. It's $199 for, I think, 8 weeks of training. It's phenomenal. It's for people who don't have any activist or organizing experience. It's really to learn the basics. And it'll start to teach you this method and how to do it. And I would recommend it to people. You can find them at changeleaders.ca. And if people are interested, I can send, actually, we have a discount, $50 discount off for anybody who's interested. I can send it out to the list of participants afterwards. But I would really recommend it if you're interested in being active and engaged in advocacy in any way, not just around this issue, but any kind of advocacy. This will give you the tools and help you learn those skills.
Awesome. Yeah, I'm definitely going to look into that. Sounds very interesting.
Yeah, it's supposed to be a really great program. Like Joe mentioned, we the Democratic Socialists of Canada, we received some donations from some of our very generous members that we put towards 3 scholarships for our members. People, we had over 30 applicants applying to get one of these 3 spots, and so they're starting on Monday. So we're really looking forward to having them to learn how to do that, and also to hear about like how the program is. So that's really great that they're partnering with us to offer that discount for people as well. One of the things that we actually haven't talked a ton about that I just wanted to touch on before we wrapped up for the evening is, the question is always like, how do we pay for this, right? So, one of the things that the DSC has is we have a think tank as part of our organization. It's called the Center for Canadian Progress. And we've actually just released our first white paper, and it's called Paying into the Community Chest. And it's all about using the implementation of a progressive wealth tax in Canada. And so it's for people with a wealth between $7.5 million all the way up to $5 billion plus. And using the PBO's calculations and their methods, we estimate that this tax would raise over $21.6 billion in government revenue during its first year. I mean, that easily pays for dental care, that pays for mental health care, that pays for university for people, that pays for a countless number of things. Joe, you were a part of developing that paper. Certainly, dental care was on your mind and on your group's mind when this was being undertaken.
Yeah, absolutely. I think this is the biggest challenge we hear when we talk about issues like this. And people say, yeah, that's pie in the sky. How are you going to pay for it? Well, we think it's relatively easy. I mean, if you look at this progressive wealth tax, there's been a wealth tax proposed actually today in Parliament by MP Peter Julian of the NDP. It's a 1% flat tax on any wealth over $20 million. And that is similar to some of the wealth taxes that have been implemented in Europe. We go through all of that in the paper, and they're fine. It will bring in about 2.1 billion in estimated revenue from the PBO numbers. NDP says about 5.6, but looking at the PBO, we think it'd be about 2.1, and that's nothing to shake a stick at. But at the same time, a progressive tax would only affect about 98,000 Canadians. Of the ultra wealthy, starting at $7.5 million in net worth, minus your primary residence. So that wouldn't be included. And it would, like you said, it would raise $21.6 billion. I mean, it's a massive number. It would transform Canadian society and would let us not only implement a lot of these programs, but decrease wealth inequality across the board, which is at its worst point ever in Canadian society. So we believe that it is. This is the vehicle. And I think when people start to say, well, how do you pay for it? We say, look, there is policy, there's plan here. We just have to create the will for that. If you would like to take a look at that paper, we're also, it's at centerforprogress.ca. And you can see it's wealth tax. We're working on I was here a little late to this because I just came over working on a housing guarantee strategy right now and workplace democratization. So there's going to be a lot of policy coming out of that think tank focused around wealth inequality and economic justice.
So we had a question from a member in our audience, Carol. They say BC is beginning to implement a primary care home model and include dental as part of each PHC team. Dental therapists would be a perfect fit within this model. The Canadian Dental Hygienists Association created a curriculum that focused on dental therapy as a stream of the dental hygiene education. Who should we be lobbying to launch dental therapy education programs in Canada?
I think that's a very important point to note, one that I should have mentioned when actually speaking about dental therapy. So the only dental therapy training program in the country was closed, I believe, in 2009. And there's been different proposals as to how we reintroduce dental therapy in Canada. One of them is to reopen a dental therapy training program as we did before. The other one is to basically add a kind of like a specialty training type thing for dental hygienists, where they can take maybe an extra year and a half training after their original schooling, where they can become qualified as well. if we're looking at organizations to lobby to affect this change, I mean, I think the Canadian Dental Hygienists Association is probably a good start. I think also as well, I think, how do I word this? Working with movements like ours with the Coalition for Dental Care, I think helps create the space necessary within the public discourse to actually ask demands from, say, dental association, from politicians. I think raising awareness within the public, you know, it takes quite a bit of legwork and it takes time, but it's something that helps create the space for politicians or technocrats to really ask for more bold solutions.
Well, you know, we are nearing the end of our time together here this evening. So any final thoughts you'd like to leave our audience with, Joe or Brandon?
I had one thought on what Joe was speaking about actually with the wealth tax and people asking how you pay for it. I think the progressive wealth tax is a great idea along, you know, there's many other ways of cracking down on the use of tax havens, taxing tech giants that really don't pay taxes in Canada and stuff. But there's also other elements as well where people think like, oh, well, middle-class taxes might go up somewhat. What you have to take into account is that people already pay for dental care out of pocket and for insurance premiums. And say if your taxes go up $150, but you all of a sudden don't have to pay the $700 you would for private insurance, out of pocket payments, all these things, you're net saving $600. So I think there has to be a big push from groups like ours to counter the narrative, because I think there's a lot of mainstream political discourse that will say, oh, middle-class taxes are going up, when in reality, the net payment that people are paying is actually going down significantly. And it's, to me, I think it's a disingenuous thing, but I do think that that argument sticks with people to some extent.
Great. Joe, is there anything you'd like to sort of last final thoughts you'd like to share with our audience?
You know, like any social movement and any real social change, this takes everybody who has passionate about it, you know, becoming a leader. It's not enough to say, yes, I will support it. And so I think it will, you know, finding a core group of leaders, people who are maybe willing to spend an hour with us on a webinar to talk about this issue might be at the beginning of that. But, you know, get involved. Learn to tell that story, learn that narrative, how we can, you know, push for social change. And, you know, this is not something that's out of reach. This is very real. Canadians want this. And, you know, once they realize there is momentum around it, and that there is a voice for them in this fight, then, you know, I think you will see a lot of support. But, you know, it has to start somewhere. And I want to just, you know, thank Brandon and the coalition for all the work they've done on this. Brandon, I think, you know, if you start looking around for universal dental care and proponents of it, your name comes up a lot. And you've done a lot of great work on this, and I think it's really impressive.
Well, thank you.
Absolutely. Well, I would like to thank, you know, both you, Joe and Brandon, for sharing your expertise with all of us tonight. And of course, thanks to all of you for tuning in and for submitting your questions. I hope you learned something new tonight and that you're inspired to start making the changes that you want to see happen. A recording of this video will be made available on the DSC's YouTube channel, and we'll also post a link to that on Facebook and Twitter. Thanks again to everyone for coming out, and take good care.
Well, I just wanted to mention one last thing. If you are interested in participating in the Coalition for Dental Care group, please, you can find us on Facebook, Instagram, Twitter, or you can email us at coalitionfordentalcare@gmail.com. We'll, you know, through one of those methods, we'll get back to you and try to, you know, we'd love the help.
Fantastic. Thanks again so much, everyone. Have a great night, folks.